Ms. Steele is recognized.
Thank you, Mr. Chairman. Before Congress stepped in, a patient receiving emergency care from an out-of-network provider or facility would receive a surprise medical bills. 7 in 10 patients were unable to afford their out-of-network medical bills, according to a previous Kaiser Family Foundation survey. Unfortunately, this scenario happened to John Hagee, who survived a serious bicycle incident and had to visit an emergency room care floor in Los Alamitos. He received a $5,000 medical bills for his visit and later discovered that the hospital and physician group were both out of network. John, like many others, had to face medical debt and significant financial burdens due to receiving vital care. The Bipartisan No Surprise Act has been successful, but we can all agree that its implementation has not, leading to physician burnout and reduced patients' access to care. I have heard from physicians across California, particularly in emergency medicine, that issues with an implementation of the No Surprises Act have caused such financial instability that many physicians are retiring early and leaving medicine. According to a local survey, 45% of California physicians said they are considering retiring early. 3 out of 4 California physicians report patient challenges with timely access to care, and 60% of California physicians report difficulty staffing emergency on-call panels. Now patients are being onboarded in emergency rooms waiting for specialists to become available. To Dr. Bleier and Mr. Budzinski, since the recent court rulings in Texas against the administration's implementation of the No Surprises Act, the independent dispute resolution process for resolving payment disputes were put on hold. Now, this month, the administration has announced that it expects to direct certified IDR entities to resume issuing payments determinations for some disputes very soon. This means that providers are still treating patients without mechanism to get fairly paid. For a provider, what does this freeze in the system do to you and to your practice?
I appreciate the question. It puts us in a very difficult situation. Unfortunately, I think the insurers and we all know that emergency medicine providers and staff working in those emergency departments will take care to the highest level any patient that presents to the emergency department, no matter what, regardless of their ability to pay. We always do the right thing for those patients. However, we can only staff those emergency departments with the resources that are available to us. So when our reimbursement is slashed below market rates, long-standing market rates in our area, and our revenue and resources are dropped, we are not, and then we have no recourse. The No Surprises Act, this wonderful bipartisan piece of legislation, set up this process by which we would have recourse in that situation when suddenly a payer where we had been in network with them for a decade or more suddenly slashes our reimbursement by 40 to 70%. We would have this ability to still advocate for ourselves and potentially still receive fair payment. But if our payments are reduced up front and then we have no recourse, inevitably what's going to happen is we are not going to be able to staff those emergency departments and put the resources in that those patients in those communities need, which is most horrible for our patients, but as you alluded to with some of your constituents, horrible for the providers and nurses and other staff working in those emergency departments who want to do what's right for those patients.
Thank you, Dr. Bleier. Mr. Budzinski.
Yes, thank you, Representative. We are a large organization, but as I mentioned earlier today, the amount of reimbursement that we have tied up with the IDR process that is broken is over $40 million in underpayments to our organization. And even an organization our size, these are substantial amounts of funds that ultimately require us to balance our budgets in some way, shape, or form. And this ultimately missing revenue does impact our resource allocation. There's no question about that.